So in this video, I want to look at the difference between a disorder and the normal range of abilities. All behaviors fall along a continuum or spectrum. At one end of the spectrum is normal behavior, normal abilities, normal individual characteristics that are considered appropriate or typical on the basis of an individual's culture, age, gender, and so on. At the other end of the spectrum are groups of behaviors that, when exhibited regularly by an individual, create problems for that person in terms of his or her functioning socially, emotionally, or occupationally. Now, most people have certain idiosyncrasies. For example, unusual hobbies, anxiety, awkwardness in social situations, clumsiness, obsessions, and so on. Now, this is considered well within the range of normal behavior. However, when these behaviors overlap or form a pattern across time and negatively impact a person's ability to function, then they're viewed as clinically significant and as requiring diagnosis and treatment. Now, there's a lot of controversy about the diagnosis of autism spectrum disorder. Some people view this as simply a different way of thinking and viewing the world. Added to the mix is concern that people with poor social skills are being pathologized. In other words, the loners are now qualifying for a diagnosis. Our society expects people to be social, and when they're not, should we really view them as sociopathic or disabled? Many of the behaviors associated with the disorder represent a focus on things rather than on people. People on the spectrum spend most of their time completing tasks rather than socializing. But consider this: if placed in a different environment, would ASD actually be seen as a disorder? In other words, if there were a large group of people that were all task-oriented, would they really view the disinterest in socializing? Probably not. So, in summary, a disorder is a behavioral or mental pattern that causes significant distress or impairment in a person's ability to function effectively and consistently in day-to-day living. For example, physically, mentally, emotionally, socially, financially, vocationally, and even spiritually. This is where some controversy enters the picture, because many, if not most, people on the higher end of the autism spectrum would say they function just fine in most areas of life, although most would admit to certain areas of struggle as well.